Welcome, welcome, welcome back to another week of Excuse Me, Doctor. A special shout out to my Be Health Empowered family. Thank you so much for joining us this week on Excuse Me, Doctor. You know, we are here every Monday night bringing you health topics based on science. So you can be confident and empowered when it comes to making health decisions for yourself, your family, and your community. We are here to do it with clarity, with compassion, and confidence. Confidence so that you can be empowered when it comes to making your own health decisions. We clarify speculation, we clear up misinformation, and we debunk disinformation. So, thanks for joining us. If you're joining us on YouTube, please hit subscribe, that little red button. And if you are joining us on Facebook, please hit like. Really appreciate you for that. And, you know, just wanted to bring in what our topic is going to be tonight. A few months ago, we thought we were going to be pivoting away from COVID. As we approached the middle of the summer, almost 70% of people had had at least one vaccination. Case numbers were plummeting, and so were deaths. They were way, way down. And then the Delta virus exploded on the scene, and exactly what we were trying to avoid about hospitals being overrun and people not being able to get care, that has happened. We actually just had a show about that last week. We had a wonderful emergency medicine physician come on and just tell us what it's like to be in the hospitals right now. And in the midst of all this, schools are reopening, and the little ones who are unvaccinated are returning to school. There's a lot of anxiety on everybody's part, the kids, the parents, the teachers, the staff. Today, we're going to talk about it. Is it safe? Does it make sense? What are the benefits and what are the risks? Why now, with the pandemic at its height, are we talking about and proceeding with schools reopening? So stay tuned. Right here, we're going to be getting to that. Make sure you share this episode with everybody you know, especially those who have kids in school or are concerned about this particular topic, teachers and staff as well. You and them definitely do not want to miss this episode of Excuse Me, Doctor. So start writing your questions in the chat. And then, as you know, I have wonderful co-producers. One of them can't be with us tonight. Shout out to her, but we do still have Mr. Wayne Bruce, who is coming in from Maryland, the East Coast, representing with the W on his hat.
You know I got to represent where I'm from. I'm from the city, Washington, D.C., so
All
I have to
right.
represent all the time. It's not for Wayne. Most people think the hat is for Wayne, but it's not. And let me say this, I'm a
It can be
little
both.
I'm a little stressed. I'm a little stressed because I
Why is that?
don't have my partner in crime here.
Oh, okay.
Well, not
Okay.
in crime because we don't commit crime. I don't have my producing partner here.
Uh,
So shout outs to Lila. Get her out of
yeah.
traffic. Everybody,
Yeah.
y'all pray for Lila that she
That
comes out
LA,
of
that LA traffic, man. It'll catch you every time.
Yeah, California dreaming doesn't always mean that you'll be dreaming at home. You'll be
You're right.
dreaming in traffic jams.
That there will be no more traffic. But
Yeah.
anyhow, we are
Yeah.
glad to have you. Glad you're here, and hope Lila will be back next week without the traffic.
Right. So if I'm looking all around, I'm actually producing too. So, give a
We
brother a
got you.
break. You give a
We
brother a
got you.
break. So let's start it off how we
With the
do every
recap.
week. We
Yeah,
start off with the
absolutely.
recap and the numbers. So
Yeah,
Doc,
well, we are now up to 41.9 million cases of COVID in the United States, and unfortunately, over 677,000 deaths. We know about 1,800 or so people are dying every day from COVID. And, we have a vaccine, and we're at 181.4 million people vaccinated. That's 64% of all eligible people over age 12 who are fully vaccinated. I think that's incredible. We are way past the halfway point now.
Give it up.
Yeah.
Give it up for the people
Yeah.
who actually. And I heard something about almost 70% have at least one shot. 75 or close.
More than 70. Yeah, more than 70% have more than one shot. So, those are people who are on their way to completing the full series. And yeah, it's pretty amazing. I think things are still going well, even though, of course, we have these deep pockets of people who still refuse to get vaccinated or even consider it, even to have
Mm-hmm.
a conversation with people who are scientists or doctors or who can advise about
Mm-hmm.
vaccines. Um, but either way, we see those states that are lagging in vaccinations having hospital crises. Like I said, we talked about that last week. Idaho
Right.
and Alaska are the two latest states for that to happen. And in both those states, the vaccination rates are less than 57%.
Wow.
Um, yeah, and they can't provide care because they lack hospital beds and they lack enough staff
Mm-hmm.
because over 30% of their patients are COVID patients, which are taking up a lot of resources. And so, I think Alaska even came out and said, "Hey, we're not going to be able to provide care." And Idaho said, "We're going to have to be rationing care."
Wow.
Um, yeah, so it's pretty serious.
So how will those numbers? What will happen with those numbers now that I heard like Pfizer announced that their vaccine is even can even is even good, has great results for 12-year-olds, 12 to 15,
Well, no, 5 to 12-year-old. Right,
5 to
it's
12-year-olds.
yeah, Pfizer is approved for 12 to 15-year-olds. They came out with some data today showing that it would be safe for 5 to 11-year-olds, but of course, the FDA has to review that and
Hmm.
ensure that, yes, it is indeed safe. That's just Pfizer saying, "Yes, it's safe," but they need an independent review by independent scientists at the FDA, before it
Right,
would get authorized for that age group.
right, right,
Yeah,
right,
great question, though. Yeah, you
right.
see these headlines, you gotta put them in context. Yeah.
Okay. So look, everybody's I know is concerned about the third shot or the booster.
Yeah.
If you got J&J, I guess that's the second shot. But everybody I know is either trying to maneuver to is trying to maneuver to the third shot or just see if it's
Yeah.
worth it.
Yeah. Yeah, so that's a great question. Well, we know that the FDA has said that boosters should happen for those with low immune systems. That was
Hmm.
a week or so ago, right?
Right.
But this past week, they vetoed boosters for everybody, but they
Okay.
did say yes to boosters for people 65 and older and
Hmm.
for those who have high risk occupations like healthcare workers. So
Hmm.
that's actually the first set of people who got vaccinated. They've been vaccinated around 7 or 8 months now.
Hmm.
But those are the people who are at highest risk, and people who are 65 or older probably have waning immunity,
Hmm.
just because once you get to be a certain age, your immune system is not as vigorous as it was when
Okay.
when you were younger. So you probably tend to be would have waning immunity sooner than somebody under 65.
Hmm.
The reason that they vetoed it for the population at large is because the vaccine is still effective in protecting immunized people against severe illness, hospitalization, and death. So that's why, they didn't extend boosters to everybody. And the Biden administration kind of got out ahead of themselves. But I think it's good because we see that there is a separation between sort of the government, the executive branch of the government, and the scientists who are independent and using their scientific knowledge to make these determinations about boosters and about everything having to do with the vaccine.
Wow. Wow. Well, that's good that it's going to go through these reviews and we'll find out soon. But I'm scheduling my dad, who's older, for another round.
Yes. And when a lot of people have been asking, is it safe to mix and match?
Hmm.
Other countries have been mixing and matching. The CDC's guidance on their website says it is okay to mix and match Moderna and Pfizer, if you, in extreme circumstances, meaning if you can't get one or the other, but
Mhm.
there's been nothing that says that it's harmful to do so. And a lot of people are looking at the data that recently came out that said they collected data from 18 states between March and August,
Mhm.
and it suggests that Moderna,
Mhm.
of the 3 vaccines, has been the best at keeping people out of the hospital and keeping them from getting really ill.
Okay. Wow. That's good to know because I got Moderna. I got Moderna. So
Right, but
I'm
it doesn't
always
mean that those people who didn't get Moderna aren't
right, right,
protected.
right,
It
right.
just shows that Moderna has been, has the has, looking at this
Mhm.
data, has had the highest rate of success of keeping people out of the hospital.
Well, that's good to know that anybody who can be kept out of the hospital needs to be out, and that's pretty cool. So look, on my in I actually had a friend lose 100 pounds over the whole pandemic, and
Wow, they were trying to, I'm assuming.
they were trying. They were
That's
trying.
amazing.
They
Yeah,
changed their diet. They now
yeah,
are all plant-based diet. Uh, and he's been really healthy and really proud of that. And we were reading that it might be helping him f-
yeah, absolutely.
more.
So, they did a study of over 500,000 people, over 500,000 people,
Hmm.
and they did it by survey, right?
Hmm.
So it's not like it was a prospective study, sort of the gold standard of studies.
Hmm.
But what it did show was that people on a healthy plant-based diet had a lower risk of getting severe COVID. And the beneficial effects of COVID-19 seemed especially relevant to individuals who live in poorer areas. The study was done in the United States and the United Kingdom. So, excuse me. So, plant-based diets seem to be most helpful to everybody from getting COVID.
Hmm.
But they also studied people in underserved areas, and it seemed to make the biggest difference in those areas. Um, it seemed that those who were in the lowest 25% had a
Hmm.
9% lower risk, meaning um, sorry, those in the highest quarter of the sample, meaning those most frequently eating a plant-based diet, had a 9% lower risk of developing COVID-19, and a 41% lower risk of developing severe COVID-19. So that shows you
Hmm.
the importance of diet. It's not the only tool that you have. Vaccines are a great tool
Hmm.
to complement that, but the importance of diet, and we talked about obesity last week being
Yes.
the number 2 association of having severe COVID-19, hypertension being the first. Both of those things can be helped by a plant-based diet, just as your friend found out with um, his impressive weight loss.
His
So,
impressive weight loss. And and
yeah.
and I want to shout out one of our viewers who is a steady viewer every week, and she's had quite an impressive weight loss. Valerie Spalding Parker, she says, "Me too,"
Alright.
but she still
Yay, go
eats
Valerie.
meat that looks like a steak. She still eats steak. So
Right, well, just be
congratulations to
clear,
her.
yeah, a plant-based diet doesn't mean that you don't eat meat. It just means that predominantly, when you
Mhm.
make up your plate, at least half the plate is vegetables. You might have a small amount of meat or use meat just to flavor the vegetables, but meat is not the main attraction.
Okay. So the
So,
base of it is plants.
right, exactly.
So let's turn to when your weight is out of control. Generally, a lot of people are coming down with diabetes when they can't control their weight, and so we started screening earlier for that.
Yeah. So, the US Preventive Services Task Force, which is sort of the task force that makes recommendations about when you should be screened for certain things like colon cancer and
Hmm.
mammograms, etc. They recently came out and said screening for diabetes and prediabetes should now begin at age 35 for anybody who is overweight or obese. And the recommendation should be followed even if the person doesn't have any symptoms of diabetes. We know that's urinating a lot, feeling very thirsty, or always
Mhm.
feeling very hungry. Because with prediabetes, before you get to that stage, it has no symptoms at all. So if you're 35 and you're overweight or obese, you definitely should be getting screened by your doctor now. Um, for prediabetes, because the fact of the matter is it can be reversed at that stage with proper nutrition and exercise, just like we talked about switching to a plant-based diet.
Mhm.
And even diabetes itself, the progression of it can be slowed and even stopped and prevent the complications of diabetes like blindness and strokes and heart attacks, etc. So, very important to know 35 is the new age to start getting screened for diabetes and prediabetes.
Okay. And there you go. And so we're going to stay on that track as I see. And people don't understand that when a doctor says they're obese, it is a disease. But you're
Yes.
saying food is definitely a cure for obesity.
So, yeah, this was a really, really interesting study that came out this week. But first of all, yeah, obesity is a disease. It is not a it is not an indictment or a criticism of somebody's body. It's an actual disease just like diabetes or high blood pressure. And researchers have found that what's going on in your gut with the
Mhm.
healthy bacteria in
Mhm.
your gut
Mhm.
actually seems to make a difference as to whether you can be successful with your weight loss efforts when you're obese. So, what they did is they looked at stool samples of
Okay.
people who lost weight versus people who didn't lose weight on the same diet. And
Mhm.
they saw that black bacteria that grew quickly was associated with weight loss. So there's certain
Okay.
bacteria that grow quicker than others.
Mhm.
And that's because the bacteria are taking more of the nutrients out of the food that you're eating for themselves. So
Mhm.
less of it goes to weight gain.
Okay.
They also found that bacteria that break down starches or fiber more quickly into sugars,
Mhm.
um, for example, were linked with making people more resistant to weight loss.
Okay.
And, you know, when you take a step back from this and you think about the plant-based diet and certain recommendations that are made, it's because it promotes the growth of certain bacteria that are great for helping you stay healthy.
Okay.
And we're seeing more and more about gut health, the health of your gut and the bacteria that are living in it being linked to more and more things. And so now, of course, it's being linked to obesity. And so that's why the food that you eat can help cure diabetes. Can help cure obesity um, based upon this study.
So I would say that would be fermented foods.
Yeah, fermented foods are one, sauerkraut, kimchi, yogurt, all are great foods that help to promote healthy bacteria in your gut.
I want to thank Yvonne Smith for that. I stole that directly from Yvonne Smith,
Thank you, Yvonne.
and I'm
One
not
of our loyal
ashamed.
one of
I'm,
our loyal listeners. Shout out to Yvonne.
I'm not ashamed. So this would be the time, and another viewer and listener said wine. That would be her. That's Gina B. Prince with
Uh,
wine. Thank you, Gina B.
Maybe rice wine vinegar, but
Rice
not
wine vinegar.
necessarily
Cook with
but
that.
not necessarily wine itself.
Right. Thank you. Thank you. Thank you. So
But thank you very much, Gina B.
this would be the time where we transition, if Lila was here, into the weekly debunk. Unfortunately, Lila is not here. And unfortunately, I couldn't get the graphic together fast enough. So we're going to do an old school weekly debunk, right? It's going to go like
Alright.
this. And that didn't work. So we go, let's break it into the shot. Yo, so I would normally say the weekly debunk, stomping out
Stopping
misinformation, stopping misinformation in its tracks. And so I've been stopped in my tracks today. And then the graphic would come on and say, Tyrone Twitter Fingers told me this. This is not Wayne Bruce. This is Tyrone Twitter Fingers, who always texts me. He said, somebody's cousin told him that that their balls were swelling when they got the vaccine. I don't know whose cousin that was, but he said somebody in Trinidad. I'm just saying, I'm just repeating what Tyrone Twitter Finger said. Is that true, Dr. Mel?
Well, it could be true that the person's testicles did swell after the COVID vaccine, but it was not necessarily due to the COVID vaccine.
Okay.
And as we all know, this was Nicki Minaj who made this statement. And what
We're
she
not gonna say Nicki Minaj. I mean,
Oh, we're not gonna say that?
no,
Well, it
we're
was
not
in
gonna
her
say it
Twitter.
was Nicki Minaj made the statement because we don't want any backlash from the whatever her little crew is. We don't want to
Okay, but
be
I mean, I'm
doxxed
just
or none of
quoting
that.
what she said.
Yeah,
I'm
she
only
did say
quoting
that.
what
She
she
just
said.
said that.
Right,
And then the
exactly.
Minister of Health came out and said something.
And I wanna say in her defense, the first half of the tweet actually had useful information in it. She said, "If I get vaccinated, it won't be for the Met." I think that's meaning the Met Ball, meaning when you make decisions about your health, you should be making them, for your health, not necessarily to go to a specific event. Um, and she also said, "In the meantime, loves, be safe." I think that's great. She also said, "Wear the mask with 2 strings that grip your head and face, not that loose one." Also, great advice. And I think if she had stopped there, things would have been great. As you know, she got a lot of backlash for what she said. And there's one thing I wanna just highlight about, the issues of swollen testicles. The leading reason for swollen testicles, both testicles being swollen in a man, would be a sexually transmitted disease. And so the infection and inflammation that goes along with that.
Mhm.
Um, I don't know if that's what happened. There are other reasons that would be much less common, which would include cancer. It would be very unusual for that to happen on both sides, as well as twisting of the testicles, which cause swelling. It can be very painful. Um, and again, that would be very unusual to happen to both testicles at the same time. Um, it's also very important to understand that just with 190 million people being vaccinated,
Mhm.
or 180, just over 180 million people being vaccinated in the United States, let alone the other millions of people who have been vaccinated worldwide, especially since we're talking about Trinidad, it would be it is expected that when you get a vaccine, there are going to be things that happen to you in life after you get the vaccine. It doesn't mean the vaccine caused it.
Mhm.
So we've talked a lot about the vaccine database and the things that get reported there. We know everything from car accidents to stubbed toes to hangnails. All those things get reported in the database. It doesn't mean that the vaccine caused them. And again, it doesn't mean that because I got the vaccine today and next week my testicles swelled up, that it was due to the vaccine. It could be due to other things in my life that were going on. And so, again, when we think about causation
Mhm.
with this vaccine, it's sometimes easy to fall into the trap of saying, attributing something to the vaccine that doesn't necessarily mean that it was due to the vaccine. So
I mean,
that's the debunk for this week. Um, you know, Thanks for teeing that up, Wayne.
yeah, it's painful. It was painful when you talk about when you talk to a man about certain areas of the body who's not a doc. I'm not a doctor. I'm not a doctor.
Right,
I'm not.
right.
She's the doctor, and I'm just the producer. But even as a producer, it can be painful.
Well, I hope all my men out there listening, all my Be Health Empowered family, I hope
Come on.
y'all are all right after that conversation.
Yeah, we're gonna be fine.
All right, fantastic. Well, thank you. Um, I'm going to say hasta la vista to you for right now, but we will be back with you shortly. And we are going to move on to our topic for tonight. You know, children of color have borne the brunt of this pandemic. And that was just a new report that was released by the Kaiser Family Foundation, which a lot of people already knew. But they showed that Black and Hispanic children are more likely to be hospitalized, more likely to have the consequence of one of the consequences of COVID-19 called the multisystem inflammatory syndrome, or MISC, which is sometimes a deadly condition where different parts of the body can be inflamed, like your kidneys, your lungs, your brain, your heart. It also showed that Black children were more likely to be admitted to intensive care units due to MISC, that Hispanic, Black, and American Indian children had higher rates of death from COVID, less likely to have been tested for COVID, and vaccinated from COVID. And if you think about it too, because of communities of color have been affected overall, they're more likely to be orphaned from COVID. And now we're sending our children back to school. So, you know, the other half of this is that Black and Hispanic parents are more likely to say that their household suffered a job disruption due to childcare needs in the past year, and to say that the disruption has had a major impact on their family's finance and stress levels. So, having in person school is crucial for interrupting this cycle. So, we have these two sort of things that we have to weigh. And luckily, we have two fantastic guests tonight to help us walk through this issue of school reopening. They're both friends of the show, they've both been here before. So I want to start off by reintroducing you to Dr. Nardos King, who is president elect of the National Alliance of Black School Educators. She has a 25 plus year as an educator and now serves as the assistant superintendent in a large school district in Northern Virginia. Thank you so much for joining us, Dr. King.
Thank you for having me, Dr. Mel. I love your show.
Absolutely. And thank you for that compliment. We also have with us Dr. Yolandra Hancock, who is a pediatrician, a public health expert, and a mom. She continues to be a tireless advocate for public health reform, education, and fighting childhood obesity. So we have lots to talk to you about, Dr. Hancock. Welcome back.
Thank you so much, Soror, for inviting me back. I just really appreciate the platform you've created here to educate the people.
Well, thank you so much. And to our Deltas listening in the audience, all three of us are sorority members of Delta Sigma Theta. So shout out to my Delta sorors as we sip our tea out of our Delta cups. So let's get right to it. So, Dr. Yolandra, the Delta variant is driving surges in many parts of the country. And the lack of vaccines for kids under 12 mean continued uncertainty for families as this school year begins. So you heard me set this up in terms of, this pandemic disproportionately affecting children of color. What are the risks of going back to school right now, given the Delta variant?
What we know with COVID is that when there are high levels of transmission, it increases the risk of our little ones acquiring COVID. Based on data that we've had since the beginning of the pandemic, we know that children are more likely to acquire COVID-19 from adults than they are from their peers. And so the more transmission that we see within adult populations puts our children at increased risk at baseline. But when you're dealing with a more infectious variant, we know from the data that the Delta variant has 1,000% more virus in it than the original COVID-19, that the R naught, or the risk of infecting someone, goes from having one person being able to infect 2.5 people with the original COVID virus every 5 days. With the Delta variant, one person can infect up to 7 people every 5 days. And so when you think about that in the context of sending our little ones back to school, especially when the entire country looks like it's on fire, when we look at the daily average number of new cases per 100,000 residents so that we can compare state to state and territory to territory across the country, Last I checked, at least 49 states and U.S. territories had higher than 25 new cases per 100,000 residents, which puts us in the red zone. That is defining, the CDC defines that as a high risk area. So almost all of the country outside of New England, California, and Maryland are technically high risk according to the CDC. So in the face of that, we're bringing our children back to school.
I think that sums up the risks and makes you wonder, well, why are we doing this now? So, Dr. King, why are we insisting on opening schools in the midst of this pandemic? What's your perspective as an educator?
Well, after the last 18 months, we realized that kids need to be in school for many reasons, right? It's the best learning environment for kids. For social emotional issues that our kids have suffered this past 18 months, they need to be around their peers. They need to be around trusted adults. The pandemic has weighed heavy on them. So it is important for students to be back in school. And I think that we've learned over the last 18 months how the mitigation strategies can work when you enforce them in your schools. I know in the state that I work in, the state legislature has passed a law that all schools in the state of Virginia are required to offer 5 days of in-person learning for parents who want it. So it's really difficult for schools to stand up what we did last year, which was a hybrid model that weighed heavy on teacher workload. We weren't ready for that. And so we were determined to open safely this year using the mitigation strategies that we learned, like I said, over the last 18 months. And because we know it's important to get students back in school.
Thanks so much for that. You mentioned mitigation strategies. Can you mention some of the ones that your school district has done?
So we require that everybody in a school building, inside the school building, wear masks. We recommend that when kids are out in the playground that they wear masks, but we don't mandate it outside. That we are still having children wash their hands regularly. We have hand sanitizer all over our schools, and to the greatest extent possible, to continue to maintain 3 feet and 6 feet distancing, 6 feet without your mask when they're in the cafeteria, and 3 feet when they're in the classroom. So we're using those mitigation strategies. And on the most part, they're working. It doesn't mean that we're not without COVID in our schools, because we definitely have cases of children having COVID and adults in our schools. But as large as the district that I work in is, we really still have low cases compared to the number of students that we have in our district. So I truly believe that 2 things: vaccinations work, because at our high school and middle school and high school levels, we see lower cases than we do at our elementary schools where children are not vaccinated.
Wow. And there was a whole thought that, and this is for Dr. Yolandra, originally that children didn't transmit COVID, which is an interesting thing. Can you comment on
Right.
that?
No, absolutely. Certainly when we look at the numbers, especially for children under the age of 10, we do see a significant decreased risk of COVID-19 transmission, even in the face of infection. For some reason, that 10-year age period is sort of the marker for increased risk. 10 and older, middle school and high school, there is a higher risk. So to hear my source say that they're seeing decreased numbers in the middle and high schools, and it coincides with vaccination ages and accessibility, that's music to my ears, especially when we look across the country. Only 43% of our 12 to 17-year-olds are fully vaccinated. 54% have received at least 1 dose. And given the news that Dr. Clarke, you just mentioned in terms of Pfizer providing the data for the FDA and eventually the advisory committee for immunization policy to make a decision about our 5 to 11-year-olds, we're going to start to see the effect of that when the vaccine is available for our elementary school students.
Yeah. So we're still hearing that whole classrooms or whole classes are being quarantined. Dr. Yolandra, can this whole going back to school be done safely? We heard about the mitigation method, the mitigation measures from Dr. King.
Mm-hmm.
What are some school districts getting wrong from a public health perspective?
There are a couple of things that I think would facilitate improvement. I don't want to say they're getting it wrong, except Florida. Florida, I'm giving you the eyebrow, but everybody else, there's room for improvement.
Right.
One, when you the first thing I'll say is putting politics over people safety and public health. When you pass laws to prevent public health measures like mask mandates in schools, I think that that's just completely asinine. You can come to the Dr. Yolandra Hancock page for your hate mail on that. But I think it makes no sense. We know that the evidence supports that masks serve a purpose. In 95, masks decrease COVID-19 transmission by 87%. So we know masks work. So schools that are doing mask mandates, kudos to you. The other issue is what my soror just mentioned in terms of spacing. For children, the CDC has recommended a minimum of 3 feet of social distancing with a mask on, 6 feet without, in order to decrease the risk of COVID-19 exposure. That's for the teachers, administrative staff, etc. So anytime a teacher takes their mask off, which is what we saw in California, where half the class ended up getting COVID, and the closer the students were to the teacher, the higher the risk. I mean, that's where we define sort of these quarantine rules that are sort of hit or miss in depending on the school that you're in. Some are just completely shutting down entire classrooms because there is a COVID contact. When you look specifically at the CDC guidelines, it's about proximity and length of time and who person was exposed to. If a child was exposed to an adult, the question is whether or not the adult had a mask on and the child and how close they were and for how long. The rule of thumb is for at least 15 minutes within a 24-hour period of time, with a distance between 3 to 6 feet, depending on whether or not you have a mask. So schools, the guidelines are there. It's important for schools to pay close attention to them because everything is outlined. Not only did the CDC provide an outline and a guideline, but the American Academy of Pediatrics did as well. There are a lot of schools doing it well. I have our sorors in Los Angeles. The LA Unified School District is a perfect example. I'm sure in Virginia, good doctors doing an excellent job where mitigation has resulted in less than 1% transmission risk in Los Angeles. They're doing weekly testing in Los Angeles. They're doing pool testing. They're making sure that their teachers, their staff, everyone is following all of the recommendations through the CDC to decrease the risk for our children.
Right. And also community spread is lower in Los Angeles, so it's easier to do that job versus somewhere like Florida, where
Right.
community spread is still very high. So, Dr. King, what are you finding among the teachers and the staff that you interact with? And certainly you have a national profile because of your role with the National Alliance of Black School Educators. What are you hearing out there in the education street, so to speak, in terms of the anxiety level among teachers and staff?
I think that on the most part, teachers don't have the anxiety level that we had in the past 18 months because they were vaccinated, right? So when we vaccinated our staff, and at least here in the county that I work in, they made the teachers a priority when the vaccine became available, that the anxiety level definitely decreased immediately. I do believe every time we have, a few of my schools have had what we call outbreaks, that people do get a little bit nervous, but I think that everybody believes that the mitigation strategies work and that you have to be personally responsible for you and keeping yourself safe while you're in our school building. So wear your mask, wash your hands, the same thing that we tell the children, we tell the adults. And they know that they have a responsibility in making sure that our youngest kids are taken care of. And so, I think that they worry about their students more than they worry about themselves. That's what I'm seeing.
Yeah.
In some districts where they're not requiring mask mandates, I think it might be a little different. But in our district where it's required to wear that, I'm not seeing that same level of anxiety.
Great. And I'm curious about, we've all heard about this bus driver shortage, and some places are calling in the National Guard. Does that have to do with the fact that bus drivers are concerned about COVID, or is it some other factor?
So I believe that, a lot of our bus drivers are retired folks, right? So they've retired from other jobs and they fall in the category of the higher risk. And I think when COVID hit, a lot of them said, I don't need this job because it was, just something, a lot of them, it's something that they were doing on top of their retirement, that why take the risk, right? So just like I think every industry has suffered through COVID, but, people have not been kind to educators, right? Through this process. We get blamed for a lot of things. And I think, we've lost teachers and staff due to COVID. We've lost teachers and staff due to SEL reasons. We've lost teachers and staff due to anxiety and just the hatred that we're receiving, not in the press and in the community. And I think that goes for our bus drivers too. You know, our bus drivers want to be respected like everyone else. And I just think it's tough. This has been a tough year for us. And every district that I know of is having a bus driver shortage. We've been able to
Wow.
figure it out. We've been able to figure it out, but we do still have a shortage. I mean, bus drivers' pay has increased tremendously, probably greater than any other group
Wow.
in our profession.
Wow. Which
So if
which
you want to drive a
again,
bus on the side, I got a job for you. If anyone's looking for a side gig.
I was just gonna say that, you know, they had to have that huge outreach around poll workers for the same reason, because poll workers tended to be older people, and they were like, I'm not having it. It's just not worth the risk. And they really did step up the social media campaign among young people to get them to consider being poll workers. And I think they probably need a similar thing for bus drivers too. But thanks for breaking that down for us. So Dr. Yolandra, what do you think? You mentioned the Pfizer announcement today about the vaccine being safe and effective for children aged 5 to 11. Once those are, if those are approved, do you think that they should be mandated for that age group?
It's an excellent question. You know, the first question that I would ask is really being able to critically analyze the data so that we could allay parental concerns. I've received at least 7 or 8 text messages just today asking what is the risk of myocarditis in the 5 to 11-year-old group. As you guys likely know, we did not discover an elevated risk of myocarditis in the adolescent population until the vaccine was made available to the general public. And so that's the first question that I need to answer for my parents before I can say whether or not a vaccine like COVID is mandated. Clearly, in the pediatric population, there are a ton of vaccines that are already mandated before a child can enter into and then continue in school. So vaccine mandates in the pediatric space are nothing new. We now see a vaccine mandate for the HPV vaccine that was relatively the newest kid on the block. And I'm not opposed to a COVID-19 mandate for our pediatric population, especially as we're going into the school year. When we look at the numbers, children make up 22% of the population, but now making up close to 30% of new COVID-19 cases. We continue to see record numbers of children being admitted to the hospital. And so as a parent and as a pediatrician and as a public health person, when I think about vaccine mandates in the pediatric population, I think about morbidity. What does this disease do to cause illness and loss of school, loss of work, all of those things, and mortality? How many lives are we losing? And to your point, Dr. Clarke, when you talk about the disparity related to all things COVID, death, infection rates, hospitalization rates, complications, we haven't even talked about long COVID. And then on top of that, the majority of children who have died from COVID, we're over 500 children now who've lost their lives to COVID, the majority of them being Black and brown. And so although there are a good number of my parents who will raise their eyebrow at me to save our children's lives, absolutely, I would be in support of COVID-19 being added to the list of mandated vaccines for school entry.
Great. Thank you. That was an excellent summary. And I have a ton more questions, but we are already like way into this. And I'm just looking down and realizing we need to bring back Mr. Wayne Bruce so he can bring us some audience questions.
Well, I just thought I would listen to you ladies, very intelligent ladies, and I would look at the audience questions, but it won't allow me to do that. So I have a few, and I'm going to start at the beginning of the show. Sheila McLean said, if you're approaching the 8th month window, should you get the flu shot first before the booster? And is the timeline 6 weeks wait after you get your first one? I guess the first flu shot.
Okay.
Is there a 6-week wait after getting your flu shot?
Before you get a COVID vaccine.
Right.
Okay.
The booster, before you get the booster.
Not okay, you lost me there. So the question is, should you get the flu shot, and do you have to space when you get the flu shot compared to the booster?
Right. Exactly.
Okay. Dr. Yolandra, I will turn that over to you if you'd like to go ahead and answer it.
Sure. So, the question is, do we apply the same rules to the booster that we did to the original COVID-19 vaccine without looking at any specific recommendations coming out of Pfizer right now, because that's the booster that's being approved? The same rules apply in terms of spacing between your influenza vaccine and your COVID-19 vaccine. Do I recommend that you get both vaccines? Absolutely. Will I be getting my flu vaccine and my booster whenever I qualify, once they have provided the data that shows me that as in the general population I need it and that it's safe and effective? Absolutely, I will get both of those. But you want to follow those same guidelines. Absolutely.
Okay. All right. We have another question from Cerise Daniels. I was vaccinated with my second dose of Pfizer in July of 2021. When would I need a booster? I'm a healthcare worker.
So, Dr. Yolandra, would you like to take that one too?
Sure. For right now, the recommendation for a booster is 65 and older or immunocompromised. So if you are a healthcare worker and you fall in one of those two categories, and I know you're going to tell me, well, some of my colleagues already got a booster, right? At least 2 million people thus far who are not in those guidelines have already received a booster because we anticipated that they were going to approve it. So unless right now you fit in one of those two categories, now is not yet the time. There are 3 questions that need to be answered. 1, how long will immune booster last in your system? 2, how strong will the immune response be for us who are not dealing with immunocompromise, either because of age or because of some health condition? And then the third and most important question for us is the safety profile, side effects and adverse outcomes. With a booster vaccine, is there any additional risk, for instance, for Bell's palsy, myocarditis, etc.? The data needs to still be reviewed to answer those questions as we move into this next phase of having a booster available for all the general population. But when those questions are answered, I would highly recommend you get a booster. I'll be right there with you, sis, to get one too.
Okay. We have another question coming from I believe Jaid Ezion. Help me today with these names, but so
we apologize to anyone,
and I apologize
if we
for
have
destroying
butchered
your name.
Yeah,
And if
please,
it's a made up
deep
name,
apologies.
I don't apologize for destroying it. So anyway, so look, so he or she asks, so why get children vaccinated if masks work? Don't shoot the messenger.
That's an excellent question. Masks work, but they're not perfect, right? So 1, decreasing your risk by 87% means there's still a 13% risk if a child is wearing the mask the right way all day in the way that you know that they need to. And we're talking everyone in the space, everyone's wearing their mask in the same way. And that's an N95 mask. I can guarantee you that the majority of children on school campuses are not wearing N95 masks. They're wearing surgical mask. For the most part, I just did a back to school physical clearance exam day to day at a school in Northeast DC. 98% of the children had on either a shirt pulled up over their face, the little neck cover, which has been shown not to be that effective in decreasing COVID-19 transmission. And if they didn't wear those, they had on a surgical mask, which also has not been shown to significantly reduce COVID-19 transmission. But unless schools are supplying masks, double layer or N95, we have to allow families to provide whatever mask they can. For those reasons, we have to make sure that we are also vaccinating our children. Number 2, children aren't spending all day long in masks. They're also at home around their family and friends, some of them who are going to choose not to get vaccinated. And even those who are vaccinated, we now know that the data shows that those of us who are vaccinated can still transmit COVID-19. And I know some of you are going to come from my neck. The vaccine was never designed to be a sterile space for COVID-19 to no longer cause infection. What it does is 2 things: decreases you from getting severely ill, or 2, preventing you from dying. Those were the purposes of the vaccine. The bonus is whether or not it decreases the risk of infection for those who are vaccinated in the face of being exposed. So for all of those reasons, children still need to get vaccinated to protect themselves.
All right.
It's so nice to be able to sit back and have Dr. Yolandra answer all these questions that I normally would be. I am going to jump in because I love analogies. And one great analogy about that layered approach is to think of a car, right? your airbag is like the vaccine, right? If it doesn't prevent the accident, but if you are exposed, it prevents serious bodily injury. The other thing in a car is a seatbelt. A seatbelt is like the mask, right? It keeps you restrained. It in the case of an accident, again, it doesn't keep the accident from happening, but it keeps you from being ejected from the car. And then the other layered strategy we have is social distancing. Think about that like the street lights, right? If people did not obey the traffic signals, we would be getting into a lot more accidents. So, social distancing is yet another strategy. None of them replace the other. They all work together to keep us being able to go down the freeway and navigate our city streets without pandemonium breaking out. So, they're all important.
So
Absolutely, and
And
these
can I
COVID
just say,
streets.
Yeah, Dr.
right, and can I
King,
just
please.
also offer, I constantly say this on my Facebook page and to anybody who will just listen to me, that the adults' behavior in our community directly impacts what happens in our schools every day. And, so adults will, have a birthday party for a group of 15, adult comes to party, adult has COVID, adult impacts those kids. Those kids go back to school, those kids impact other kids. We're pausing kids because of that. And then parents are upset with the schools. We as a collective community are responsible for keeping our most gracious assets safe. And if we
Yes.
don't check our behavior, then we're going to continue to interrupt these kids' civil rights and their education. So I want to put that out there to the adults because sometimes I think that they just forget
Yeah.
that we're still in
Preach,
the middle
Dr.
of a
King.
pandemic. Yeah.
And that's what community spread means. When community spread is low, it means that adults are doing what they need to do. That's when community spread is low.
wow. So we have entered the speed round. I would like you to keep your answers to 30 seconds if you can. So Ralph Williams says, I have heart failure. Is that going to be an issue with the vaccine? I have not been vaccinated yet.
Heart failure is not an issue with the vaccine. As a matter of fact, heart failure patients were included in the clinical trials, and it was shown that they, just like any other people with underlying chronic illnesses, are protected. If you have any doubts, check with your healthcare provider, check with your doctor, have that conversation with your doctor so that your mind can be at ease when you go to take the vaccine. But you're at higher risk from COVID with heart failure, at higher risk of dying and having complications from COVID should you encounter it if you're not vaccinated.
Okay. We have a question coming from a former guest, Meaty Clarke Barnelli. She says,
right.
Dr. Yo, are you suggesting kids wear double layered masks?
Yes, I'm absolutely recommending that children wear a double layer mask. Clearly, you want little ones to be able to breathe comfortably in their masks. Having a double layer, either having a mask with a HEPA filter within it to protect our little ones. My little one has been sent to school with N95 masks. I probably got one of the last boxes before the prices went insanely high, but that's what I'm sending her to school in so that she consistently is protected. You want to make sure that the mask fits well. What I would recommend is try on a couple to see which one fits most comfortably for your child and allow them to pick. My little one plans on becoming an astronaut. So when she doesn't have to wear the N95 mask at school, she gets to wear her space mask, which is also double layered.
Wow.
Excellent.
Can I say something as somebody who's in schools every single day? You need to
Please.
sit down with your kids and talk to them about the importance of wearing their mask correctly. All day we're telling kids, put your mask over your nose, sweetie, put your mask over your nose. And when they're in the cafeteria eating, to stay out of each other's faces. You have to have those conversations with your kids because they're doing it. They take their mask off and they're talking to their friends and they're like this. We need to make sure that the kids are educated about keeping themselves safe as well.
Right.
And send several masks, please, because these masks and what they do to them.
They get wet. They get all kinds of stuff on them. They get trampled into dirt. Yeah, all of that.
All that.
Yeah.
And those are the final words.
Well, Thank you so much for those questions. My audience y'all always come through Be Health Empowered Family with some fantastic questions. Thank you to my guests. Y'all were fantastic. Uh, Thank you, Dr. King. Thank you, Dr. Hancock. You all made the show with your wonderful words of wisdom. And just to summarize and have a few words in closing, um, you know, it's it's a balancing act, the decision to send children back to school. I think we've heard that tonight. On one hand, we are in this Delta surge, but in the past 18 months, we've learned about how to do it right, and how to send children back to school safely. But it's a matter of us as adults in the community playing our role, talking with our kids ahead of time, not setting up situations at home where spread will happen, where they will then take it to school and spread it to each other. Um, it's up to the schools to enforce the mitigation efforts, including, we didn't talk about it, but also ventilation, having adequate ventilation systems and windows that open and protocols to keep children safe. Um, and, our children have suffered alongside of us in this pandemic, and it is up to us to make sure that they have high quality educational opportunities, in-person education, the opportunity to be able to play sports safely, because the other thing I didn't mention is childhood obesity has skyrocketed in this pandemic. And so the role of in-person physical exercise too, all these are important. So it's possible to do. We each have to play our role in doing it safely. So I will be on the Russ Parr Morning Show tomorrow morning. I hope you can listen in. If you happen to be in one of those markets, I'll be on at 7:45 Eastern Time. And if I don't see you then, or before next Monday, when I'll be back at 9 o'clock Eastern, please remember to be wise, to be well, and to be health empowered. Thanks so much for joining us. Thanks to my wonderful producer, Wayne Bruce. Thank you so much to my awesome guests tonight, Dr. Nardos King and Dr. Yolandra Hancock. We will see you again next week. Take care and be safe.